February is American Heart Month, and it's a good time to get facts about heart disease and your health.
Lucky for us, we have just the person to call on. We asked Dr. Rupi.
Heart Health Month continues on Living 808, and we're checking back in with Dr. Rupi to cover some of the risk factors. It is such a big killer, #1 here in the U.S., so it's important to identify what are some of the big risk factors related to heart disease and heart attacks.
So when it comes to risk factors, we are talking about risk factors that are modifiable, meaning we can change them, and risk factors that we can't change. So in general, when you think of a heart attack or a stroke, cardiovascular diseases, we think of an older man, whereas that's actually not the case. Women can get cardiovascular disease, young people can get cardiovascular disease. And so I think it's so important that we work on the risk factors. These days, 1 in 4 deaths is caused by cardiovascular disease. That means about 1 person every 36 seconds in the United States is dying from cardiovascular disease. So that's why it's so important to focus on, okay, what can we do? What are the things that we can change? We can't change our genetic predisposition. We can ask our family members so that we are aware if we are predisposed to developing cardiovascular disease, meaning anybody in the family have a heart attack, anybody in the family have a stroke, there's a chance that you might have a higher risk. But there are a lot of things that we can change, and that's what we're going to focus on today. So some of those things that we can change. Let's talk about chronic health conditions. Diabetes and hypertension tend to be fairly common medical conditions that are chronic, that we have to take medications for. The better control that we have of those conditions, the less likely we are to be at a higher risk. So what happens with diabetes and with high blood pressure is that over time, our blood vessels get damaged. And the damage to those blood vessels puts us at a higher risk. Now, if we control those and we have good blood sugars, we have good blood pressures by taking medication or modifying our lifestyle, then we have a lower risk of any of that damage from occurring. Now, there are some risk factors that tend to be very easy to modify. And I say that with a little caveat that easy isn't always easy. But some of those things are being overweight, eating an unhealthy diet, having a sedentary lifestyle, smoking is a big one, and drinking alcohol. Those are all things that we can work on to decrease our risk.
What are the steps that we can take to try and turn the tide on those risk factors?
So something that's really interesting is that people with close relationships in their family, in the community, even at work, tend to live longer and tend to be healthier. Now, why is that? Because you've got people that care about you, you are more motivated, and you can be inspired by the people around you. So one suggestion that I have, and in general is a good idea, is to buddy up or to talk to others or get others to try to be healthy with you. One of the simplest steps that you can take is to move more. Now, what do I mean by moving more? The general recommendation is to get at least 30 minutes of activity 5 days a week. Now, that sounds a little daunting until you kind of think about what does that actually mean? What should I be doing? Even something as simple as taking a walk on a lunch break with a colleague, that contributes to that activity. Or having fun activities with your family, jumping rope or skipping, or having a fun game of tag football with your family members at home. Something like that increases your activity, increases your heart rate, and actually protects you from cardiovascular disease. Now, other things you can do are healthy diets. Now, this might not be as easy, but small steps can lead to big changes. So share some healthy recipes with friends and family, or have a cook night that you choose a recipe, family chooses a recipe together, it's healthy, and you cook together. Other things that you can do are getting sleep. So it's really interesting how sleep and stress really play an impact into your overall health as well as your cardiovascular health. So getting 7 to 8 hours of sleep a night actually decreases your risk, as does decreasing your stress. Now, stress management, it's difficult. It's not something easy, but even trying to start to meditate or finding relaxation techniques. If you need to take a break, take a day off if you need to from work for self-care. I think that's really an important piece that we sometimes forget about.
All right, well, I'm going to tell my boss maybe Dr. Rupi said I need to take a day off.
Uh-oh. No, I will happily write a prescription.
As always, it's so great to talk to you. And what is your website again for people to read up and get more great life and wellness news?
Sure, it's drrupi.com, and I am on Instagram and Facebook at dr.rupie.
Thank you. We'll see you next time, Dr. Rupi.
Thanks so much. Take care.
need?
I didn't hear
need
you.
More sleep. What is that?
Yes, is that so? You can always check out Dr. Rupi. She's our go-to for wellness advice, and we'll post the link on KHON2.com. Now, speaking of heart.